Good day and welcome. My name is Russell Hendrickson. I'm the CEO of Practical Data Solutions, and thanks so much for joining us for quarterly revenue checkups, keeping your practice financially fit. And I'm so pleased today to have Shawntea or Taya Gordon joining us. Taya, welcome.
Thank you so much. I'm the CEO at Atlas and Perpetua Healthcare Consulting, and I am extremely excited to be chatting about such an important topic. So thank you for having me.
Throughout today's webinar, you can submit your questions anytime using the Q&A tool below, and our moderators will answer them. So quarterly revenue checkups. Today's webinar, we're going to cover, what are they? Why do they matter? What should we be looking at each quarter? How do we go beyond those service level metrics? How can analytics play a part in making better quarterly reviews? And then how do we create some kind of a sustainable performance? And I love that word cadence. So Taya, if you would, why do they matter? What are we doing here?
You know, the need for a quarterly revenue cycle checkup really stems from the fact that the revenue cycle is constantly changing. Policies change, guidelines change, our workforce, their skill levels, even who we have employed turns over, right? And if we're not looking at these things on a regular basis, then all of a sudden we can kind of end up wondering where the revenue cycle went off the rails as opposed to knowing where it was going all along intentionally. So it's really critical that we just stay on top of it, that we are looking at those critical metrics that we have and really focusing in on those.
So not unlike a physical health or a health checkup, right? Making sure we're checking in so we know where we're headed. Um, I,
Exactly.
I love that you talked about employees, and to me, one of the biggest things with these quarterly reviews is getting employees involved, right? We can't drive change if we don't understand both what's going on, but then also make sure everybody else understands where our challenges are, where we have room for improvement. So if these quarterly reviews aren't just to say what's going on, it also helps us get everybody involved, which ultimately will drive better financial and just outcomes overall, which is pretty exciting. So let's dig down a little bit. What should we be looking at each quarter if we're going to do these quarterly, reviews?
Yeah, great question. There's a handful of KPIs that I think are really critical for quarterly review. And of course, you can always review these more often than that. But some that are really sort of, I would say, the foundation of what you should review on a quarterly basis would be the gross collections ratio and your net collections ratio, which both tell you about how much am I getting paid as compared to what I billed out. Your aging AR balance, how much of what I build out is sitting out there somewhere, how long is it sitting out there is what your average days in AR tells you. And then other KPIs that really, when we mix them together, further inform the revenue cycle, right? How long is it taking us to get those claims out the door? How often are we collecting our entire balance in our aging? And how many claims are being denied? Things like that all lend toward the effectiveness of our revenue cycle. And we definitely can't forget the patient access components, right? Our third next available appointments, our schedule adherence, KPIs, those things that are informing not just how much money are we billing out and getting in, but everything also around patient access and care. How are we performing in that arena as well?
And I love your starting with KPIs, because what to me, this handful, you've got sort of 10 very popular KPIs, but as we're going to talk about being able to dig down, do we do, matched collection ratios or unmatched, right? Being able to get to even denial rate, we could spend an hour talking about what that is, and we're going to dig down into denials just to point out that as we talk about essential KPIs, they do need to be tuned, right? This is a key part of the quarterly review.
Yes, it absolutely is because when you start identifying your KPIs for most organizations, the first time you do it, you identify your baseline, right? And then from that point on, you're trying to identify is what changes you're making, are they working? If you make a process change or an automation change, how is that impacting your organization? And if you're not measuring it, you really don't know. So understanding those KPIs, becoming comfortable with them, looking at them regularly, that's how you identify trends early. And that's how you strategically prevent really significant issues in the revenue cycle from exacerbating. So when we talk about KPIs at a high level, right, they all have fancy names, they all have different formulas. But why we're reviewing each one and the goals for reviewing each one look a little bit different. When we're looking at our gross collections ratio, we're looking at the total payments that we got as compared to the total charges we billed out. We're never going to expect that to be really high because we bill so much higher than what we're allowed to receive or what we've negotiated to receive from insurance companies. That's why we also have a KPI for looking at our total payments as compared to charges once contractual adjustments have been taken out. That tells us of what we were eligible to collect, how much did we collect. In this way, each KPI, what it's really doing is giving us a little bit more toward the story of our overall revenue cycle health. And it's allowing us to set our own parameters of good, better, best so that we can keep an eye on these things. And now, keeping an eye on that can be a different matter. If you don't have access to reports in your dashboard, that's a little bit more challenging. And that's part of why it's so essential to make sure you have access to those things. For example, if you look at this screen, two of the KPIs that we talked about, your average charge lag, which you see at the top there, and your days in AR, which you see at the bottom there, if you look at those, you'll see that those lines trend similarly because they are tied together. Your charge lag is taking a look at how long on average does it take between the date of service and when your charges were entered into the system. The longer that takes, the longer claims sit before they're submitted to the payer, which means that time, that turnaround time from when you get paid is also delayed, and thereby it drags out your average days in AR. Now, that's not the only contributing factor, right? We also have to look at things like your denial rate and denied charges and what do those trends look like. When you start to combine all of these and look at all of these visually together, it begins to tell a story and give you the areas that you should focus on when you are optimizing your processes, your technology, and engaging your people and helping to upskill them and give them the resources they need to really improve the revenue cycle.
Yeah. So as we think, and I think this dashboard is a great example of we start with KPIs. What are those key metrics that we're focused on? Then can we put them together not only to correlate them, but also can we make it visually appealing? Can we make it easy to see what's going on with our charge lag? In this case, you can see we've actually improved performance, and maybe it's bounced a little bit up, but we've even got a target or a benchmark in there. So as we start to correlate data, as you'll see, we can then get better insights. And we're going to talk more about that in just a second. The other thing that I like on this dashboard is over on the left side. Even though we're looking at financial metrics, I love this. Would the patient recommend the group, that patient satisfaction metric? Keeping in mind that as much as we're focused on the financial health, we always want to make sure we're satisfying our patients. It can't be all just about money. That's, to me, that sort of side focus, right? Wasn't in the KPIs, Taya, that you talked about, but essential, right? Making sure that our patients come first.
Absolutely. I mean, that's our core customer when we're in the business of medicine. But I think also most of us are in this business of medicine because we want to take care of the community. So while we absolutely want to keep the lights on, I think that patient satisfaction score and whether or not they would recommend the group is incredibly important. And similarly, it's the same for employees. Would your employee recommend to somebody else that they come work there? I think most employees want to do a really great job. They want to see that they're helping move the needle in a positive direction. And to your point, being able to see some of the data like this, it makes a difference. If you're working with your front desk, for example, on your schedule adherence and improving the scheduling rates that you're seeing in the organization, they may want to see some of those data metrics. Or perhaps you've noticed that you have a really high percentage of coding issues, right? Or AR aging or credit balance issues. They may, once you come to them and say, look, we're going to change some processes, we're going to change some procedures, we want you to do a better job at this. They're going to want to know if they're doing a better job once all those things are implemented. And so, how do we share that information with the staff widely so that we can, one, celebrate together, but two, continue to optimize? Because the revenue cycle really, it requires continuous optimization. So how do we make sure we're communicating those things quickly without having to sit in a meeting for a very long time over a lot of spreadsheets? We need to make that information easier to digest so that we can communicate it to our teams quicker.
Yeah. So just another style of dashboard here. And Taya, to your point, we've got sort of green arrows and red arrows, right? So either we're on target or we're not on target. We're improving or we're not improving. Those are just some of the ways that we can make the dashboards easier to follow. right? And of course, design, color, and even presentation. So often people will say, well, we do these metrics, but my dashboards don't look as good as yours. And my response is, it does really matter, I think, getting people's attention and keeping them engaged. That's one of the reasons why we're reporting on these metrics. So as much as you could say, well, as long as we know what's going on, but I still would say there is a value to having dashboards that are easy to follow and sort of attractive to look at. They do make it easier.
Yeah, I would completely agree. And I think also when we're presenting to our leadership teams, our boards, our physician owners, it's important for us to remember that most of our clinicians are scientists at heart. They took a lot of math classes, a lot of science classes, and they enjoy being able to see the data, that evidence-based approach to the revenue cycle, something that speaks to every department in the organization. So I also think that we're communicating in a language that's easier for everyone to get on board with.
So let's move on a little bit. How do we get beyond those surface level metrics? How do we get beyond what you're seeing on the screen? And we've already sort of pointed this out, Taya, you mentioned in the beginning, when we think about using data and analytics, why are we dashboarding, right? Well, very low levels of analytics is we just summarize data. We do a chart, a trend. We can see, are we trending up or down? That's helpful. But really, what we need to do is start to bring in benchmarking, which is key. If we don't have a target, if we don't know what the industry is doing, we can't compare our performance and say, are we really doing well? We may be improving, but if we have a 25% denial rate, just because we went from 30% to 25 doesn't mean we're in good shape if the industry is running at 7 or 11, right? And then ultimately, when we start to correlate metrics, like you saw right in the beginning, we can then do relationship analysis, which is how are denials tying in with our net collections or our contractual adjustments, and is scheduling impacting our revenue? And we're going to talk just a little bit more about digging down. So let's do that next.
Yeah, so let's talk about combining KPIs because there's a couple of different ways you can look at your data differently. And combining KPIs is a way to really further along the narrative of your revenue cycle. So when you have these different indicators, these different metrics you're looking at the relationship between them informs a little bit more for you. So the example we have here, and this is a real world example. We have a client with a 98% collections rate and a 27% denial rate. This is really telling a story here. So the net collect rate is telling us that of what they're eligible to collect based on their negotiated rates, they're getting about 98% of that in the door. But with a 27% initial denial rate, what that tells us is that somebody's working really hard to get that money in the door. These aren't claims that are submitted and are just being paid at the first pass by the insurance company. These two KPIs in combination are really telling us that the organization is getting paid, but probably at a high cost. When we dig in deeper, we tend to find that the root cause is usually due to something different, like errors with front desk entry, with patient demographic information, challenges with the claim scrubbing process, things of that nature. But we still don't want to guess. What we want to do, kind of next step, is to dig into the clean claims rate, dig into the top denial reasons, and then even consider slicing the data differently to get additional viewpoints.
And so we're really talking about something that's near to what I do here, which is, how are we going to slice through data? But before we do that, Tay, why don't you explain how you want to slice up that denial data and what is it telling us? And then we'll go in and explore that.
Absolutely. So I think most organizations review those top line KPIs we talked about in the beginning. But even just looking at those is kind of surface level, right? When we start looking at the data in a variety of ways, just like we talked about with combining them, that's when we start to get depth to our story. We also need to slice the data multiple ways. So, for example, this client had a 15% denial rate overall. And if you look at the top 5 issues, it was missing information, must be submitted to the primary insurance first, meaning coordination of benefits issue. Documentation was insufficient, patient is not our insured, and subscriber ID is missing or incorrect. So if you look at it just like this, then missing information's your biggest issue. But let's say we slice the data differently, and instead of looking by the denied reason, we look by the department that was responsible, right? The department that we can attribute to this particular denial. If we look at it this way, that we see that the actual driver of the largest amount of denials is issues at intake. because missing information, the primary insurance denial, patients not are insured, subscriber ID is missing. All of those are things that should be cleaned up during the intake process. So when we start to slice the data a different way, we start slicing by department, we begin to hone in on a area, potentially a workflow or personnel or a resource or technology that we need to update or rework to help optimize. And that, in this situation, made a larger impact to the organization than simply looking by reason code alone.
Okay, so Taya, you unpacked a lot there. So let's go into analytics here, and let me see if I can summarize some of that. And in the process, I'm going to show you the ability for analytics to really do, which is get down to what's really going on. So at a very high level, what you're looking at here, this is a visual analytics, but it is fully interactive slice and dice. So as you can see, we have different departments. We can see right away that these 2, 3 departments have very high denial rates. You can see just what you said. Maybe it's intake, registration. If I click on registration right away, you can see we have one department that's just jumping out. As we slice down though into different levels of data available, we can start to understand what is our matched denial rate, what kind of things are going on with recovery trends. We can start to see that we've got some of the biggest challenges are with Blue Shield. We could continue to filter through into that department, start to understand, what are we writing off? What are we actually collecting? We can get as granular down into the detail as we need to. And then all the way, even understand, are the physicians driving some kind of impact, potentially with documentation. But in this example, what you said really, I like this last sort of slice and dice screen because we can start to see, where we're having trouble. If it's registration denials, we can start to see which departments, stand out with those biggest challenges. We can start to see where Blue Shield is. And ultimately, when we think about denials, just what you said, you might be working really hard to recover. We can even go so far as to say, show me the high volume denials. I'm just circling the recovery rate very low. And what are the top procedures? And so very quickly, we're now seeing the top procedures that we're rarely recovering after a denial versus some of these procedures over on the other side that, we have very higher recovery rates. Of course, I had just filtered through on registration denials, but if I open them all up, it's a little easier to see what's going on. At the end of the day, good analytics, and this is really a key driver to being successful with the reviews. It allows us to what I call the trio of analytics. It's having that visual that we can slice and dice, and if need be, actually drill all the way down to the individual denial detail. What was the claim? Who was the patient? When did we bill it? And then did we recover it or did it get written off? And what are those denial reasons? So being able to categorize them back. So Taya, I don't know if I covered everything you said, but I think at least at a very quick glance, hopefully those of you who are watching get a feel for how being able to dig deeper allows us to understand what's really going on, that root cause.
Yes, I completely agree with you. And I think too often, particularly as executives in the healthcare industry, as administrators, we have a sense of what the problem might be. We have a gut feeling of what the problem might be. And so we are at risk for confirmation bias. We are at risk for trying to solve the wrong issue. So if you want to really get down to the root cause, you do have to dig deeper. And that means using analytics to enable those improved reviews.
So Taya, can we talk about how do we use analytics to enable better reviews? What do we mean by that?
Oh, yeah, great question. Most non-healthcare entities have a strategic quarterly business review or QBR meeting every quarter. And the goal of that is to look at their performance, to talk about future goals, make sure the team is in alignment, and really to assess and improve their strategy and their approach to that QBR. So to kind of kick that off successfully, what we recommend, one, use a single source of truth for your quality metrics and your quarterly metrics. The reason is you don't want to pull a report out of one system that is maybe basing on date of post and another one that's basing off of date of service, or maybe one thing calculates charges differently than another system does. So it's really important that you have a single source of truth, that you've defined those KPIs, that you've defined good, better, best, and that you're trending those views quarter over quarter on your focused KPI set. The key is that this should tell a story. Your QBR shouldn't just be a screen full of numbers. You should be able to segment down, look by payer, look by department, look by site, and by provider. Drill in, because what you're looking for is those deltas. You're looking for the outliers. You're looking for the variance, because we want to eliminate it. Whenever possible, if we see a high denial rate with something specific, we want to know, is it a specific payer, a specific CPT code? Is it a specific time of year that it's happening? And how can we prevent that going forward? What can we do internally to prevent that type of denial? And then we really want to make sure we're tracking our actions, not just the dashboards. So when we're changing things, when we're optimizing processes, creating new workflows for staff, upskilling our staff. How are we tracking that? And how are we looking at performance prior to the implementation of those changes and performance after the implementation of those changes? You want that closed loop story being able to be told. And that is when you really start to see changes in your revenue cycle. If you're just popping up numbers and saying, this was green, this was green, this was red, that's not as effective. You're not going to see changes as quickly as you'd like to see them.
Taya, again, you touched on a lot of great points there. Oftentimes our analytics and our reporting will tell us what's going on. We may want to focus in operationally. We know we're having a problem, let's say, with those front desk rejections, or maybe with, optimizing schedules like I'm showing on the screen here. The key, though, is we then also may need something specific for our quarterly business review. How are we trending? How does this compare period to period? And are the things that we're managing now under control, but are there new metrics that we need to sort of turn? So I often encourage organizations, what you might be looking at quarterly has to be potentially different than the things that you might be managing on, especially when you have a challenge, whether it's scheduling or denials. In this case, though, to reemphasize a couple points, the fact that I can literally click through my dashboard, making changes on the fly to understand and see different levels of performance, and the data will change, right? Or, we talk about understanding where the gaps are. This is what I love to show, this performance potential. These are physicians, and this is visits per session, per 4-hour session. And we've just drawn in an internal target or benchmark. So we're saying the average within the department is 13 patients. So these physicians are performing above, these physicians are performing below. We're not trying to shed heat. We are trying to shed light that if these bottom physicians could see more patients, we can calculate what that performance potential is and make it clear how we're performing. Now, that might work great initially, but again, quarterly, we might say, did we move the needle? If we focus on the bottom 20%, can we drive revenue up? If we don't have a way to measure that in our quarterly reviews, we're not going to understand what's going on. So it's not just about having good data or being able to slice and dice. It's then being able to organize it in a way to tell the story as we go. So moving forward, how do we then create it so it's sustainable, that we have this performance cadence? Because sometimes we may start on a process and then we get too busy and there's a crisis du jour. My partner used to say all the time, how do we try to make this maintainable so it's manageable?
Yes, I think that really comes down to breaking things into that quarterly cycle. And something that I really like about the revenue cycle, if you break it apart into 4 chunks or 4 quadrants, the revenue cycle has 15 to 18 steps in it, depending on who you ask. But it's really clear that one section of the revenue cycle is all about getting information from the patient. The second is all about getting information from the provider. Then we're getting data and information from the payer, and then we're getting it from our own practice and our own performance. When you look at these 4 quadrants, they align really well with the 4 quarters in a year. If, for example, you focus on that first quadrant of getting information from the patient in Q1 and really hone in on developing those KPIs for patient demographic information, you're doing it at a time when most patients have brand new insurance information, brand new deductibles. So you're also doing that at a time when you need to be focused with that department on those KPIs. You're still going to look at them every 90 days, see how that performance is going. But at least once a year, you want to take a look at, what do I need to change in that department? Are our KPIs telling us everything we need? Do we need to add any, tweak any? Are we performing so great that we need to redefine what our goals are? And you can split this up by each quarter of the year. So Q1, focus on optimizing the KPIs for patient data, getting that in as accurately as possible. In Q2, focus on provider data. What information do you have from chart audits? What about the accuracy of the embedded coding or the leveling of their E&M visits? Talking about new codes, new CPT codes, or to your point, Russell, in your last slide, do we have providers who need to see more patients? You still want to look at every single one of these data sets on a quarterly basis. So you're not just going to look at the patient data KPIs January, February, March, but every January, February, March, you want to take a look at, do these need to be tweaked? Is there something we can be doing better? How do these compare across the last 4 quarters? And is there anything that we need to shake up or do differently throughout the year? When you look at each section of this, patient KPIs, provider KPIs, payer AR, things of that nature, and your own practice performance, you're telling the full cycle story of what's happening with your patients and their claims. The full cycle from before they even stepped a foot in the door, from when they got scheduled, how well did we take care of this system of revenue cycle from before we saw the patient all the way through to tracking our own metrics and measurements. And when you do that on a quarterly basis and annually, you kind of separate and delegate out which area you'll be focused on per quarter. What you've done is created a really strategic and intentional plan to attack the revenue cycle. Because if you don't have that consistency, you're really going to find yourself in trouble. I think the key to consistency, there's a couple of things, right? You have to set an intentional plan. You need to set intentional time. If you set it for a meeting that you always move, that's not consistency. Consistency is also not just reviewing your data once a year or only reviewing it with the billing department. You need timely access to data that is accurate, to data that you can slice, to data that can be digested quickly and communicated easily, because your goal is to identify issues as soon as possible, to get to the root cause as quickly as you can, to know that that is accurate and have trust in the data, and then to make sure that once you've solved for that, that you are still continuing to review and do those lookbacks so the early issues you identified and solved for don't recur, and so that any new ones that pop up, you know about soon enough that you can effect on them. That is when we really start to see that long-term revenue cycle improvement. Considering an external review is something I always recommend, and there's a few reasons for that. One, internal teams, while they are fantastic, and I've built several internal teams over the years, you may be excellent at hiring. You may have a fantastic team that you trust implicitly. Regardless, every team has blind spots, real blind spots. And cohesion often can favor harmony over challenges. And what happens is then you miss alternatives. So, is it possible that you could implement an automation that makes life easier for all of you? Is it frictionless? Probably not. Did you get a little bit of pushback? Possibly, but you should still look into those things. And sometimes an external review can highlight something that you're missing. In addition, external reviewers are kind of a proven antidote. Sometimes they surface blind spots. Sometimes they find patterns that other people are missing. Sometimes what they're doing is helping to validate what leadership has already been considering, but hasn't yet moved forward on because they were waiting for an expert opinion, or because they wanted a little bit more information before they trusted in the leadership team to permit that to move forward. So whether you're trying to identify your blind spots, trying to make sure you have a really good strategic plan, looking for any potential patterns that maybe you missed, or you just want somebody else to tell your leadership team, look, we're trying to do everything in the right way. Having an external review solves for all of that at once. So we do recommend doing that. I recommend external reviews at least on an annual basis. Some groups do it more frequently. Some groups do it quarterly or outsource their quarterly business review to keep them honest. There's lots of ways you could look at that, but I do think that having somebody else come in and take a poke around the shop is always good. It's great to get a fresh set of eyes and a fresh opinion.
Excellent. Let's talk about, success factors and analytics. There's a couple key things here. Number one on my list says specialty specific, but I'd like to say generally your KPIs, if they need to be tuned, if you're having challenges in your organization, right? Being able to tune those KPIs. Too often I hear, well, we can only get it this way out of our EHR. Well, if you know the metric isn't right, if you know you're not really measuring what you think you're measuring, that's not going to help you be successful. It's a little bit like putting something on the table and saying, well, this is the best we can do. It's the same thing. If we're going to review quarterly, we want to make sure we've got the right measurements. That's key to being successful. Oftentimes, though, it also means we've got to have good definition. Tay, you said it earlier. Let's agree on the definitions and make sure we're measuring everything the way we think we're measuring. And so sometimes that takes what we call these adaptable data models. I'm not going to explain that too deep, but it really means having data sets that we know we can trust, we can count on, and are really measuring what we need. And then going further, that everybody understands what we're measuring and they know how to go get the answers they need. So if we see a problem with denials, we see a problem with registration, or we see a problem, everyone has the ability to go in and dig into the data. We don't have to go ask that one person who then's going to go into some spreadsheets, try to figure out what's going on, and we lose traction trying to solve the problem. We spend more time trying to get data we need. So, and then ultimately, it's the same thing. We've got to have a commitment to these quarterly reviews, but we've also have to have a commitment to having the right tools so we can measure and do accurate quarterly reviews. And Taya, I love your comment about bringing in somebody from the outside, because too often, instead of, really addressing what might be a hard hit issue, we've got to have a commitment that we're going to try to do this as an honest process. And so whether it's an outside consultant looking at things, raising the tough questions, or making sure you have the right data and nobody's just trusting that, well, we can't get data any better, so it's got to be a certain way. From my perspective, the value of analytics is it's not just that we can get to a report, it's that we have a tool stack. We have the ability to sort of build a solution that as we evolve our needs, our metrics, and even these quarterly reviews, the questions you're going to be asking of data, if you're doing this correctly, you're going to need to be able to ask more questions to really hone in on what's the root cause and how do we fix it. So to me, those are just some of the key value points that make analytics a key part of this process.
Yes, I completely agree. And you mentioned transparency in the data and making sure that your team can see that. That is one of the challenges I see the most frequently
Mm.
is people kind of hiding it, or there's some opacity, like it's a secret or something. But here's the thing. The NFL teams, whichever one is your favorite, your college football teams, whichever one is your favorite, they're all reviewing tape together for a reason. So make sure you sit down your teams, look at the data together, and sometimes they tell you something you never thought, you know what, we should look at that. And what you get is just a more comprehensive review and a better outcome. So fully agree with that. I'm so happy you brought that up.
Excellent. Yeah, it's the old shed light on the challenges. We're not trying to shed heat. We're not blaming. We're saying we have a problem. Let's focus in on it. Let's understand it. And then let's certainly go and do something about it.
Agreed.
Taya, you and I, we've talked enough in the past. I think we're both, I could say it without saying, we both like Disney, but I love this quote. The way to get started, right, is to quit talking and start doing. And even if you're not prepared to do a whole quarterly review, start with what you can do. Start, take one point and say, we're going to commit to doing this, and we're going to build that process, and we're going to evolve that process. That would sort of be, my one talking point. At least if you learn something today, take it and commit to trying to do something with it. Even if you take 4 or 5 of the key ideas from this session, try to take action. Tay, if they want to learn more about what you do, could you give us just a little bit of highlights, some of the other areas that you do and where your focus is today?
Sure. Yes. Thank you for that. I appreciate it. So, my company, Atlas and Perpetua, our primary goal is education, training, and assessing in the revenue cycle space. I'm not an outsourced biller or anything like that. What I do is help with strategic guidance at a high level, with coaching teams, educating them, and kind of trying to teach people how to fish. There's a lot of people that need help in the industry, and so I don't want to work with the same group forever. So we've really been intentional about building models that allow you to do what you need to do on your own going forward, while allowing us to help you get all of the steps you need in place to do that. So whether it's a full assessment, an ongoing cycle of assessments, strategic planning, training, or coaching up, that is pretty much what we do underneath our organization. And everything else we leave to the other experts in those areas.
Excellent. And Taya, I'm sure if anybody's interested or has questions or follow up, reach out to Taya. She'd be happy to answer them and connect
Yes.
up with you. If you're not familiar with PDS, some of the other areas that we work in, so we're really strong in healthcare analytics. That is our focus. And we like to say these focused business insights, can be everything from revenue cycle analytics to helping with RVUs, customized measurements, digging into patient access, cycle times, scheduling data, physician comp, a big area we're working in because when we start to roll up what's going on in revenue cycle, are we productive? Ultimately, we want to make sure we're taking care of our physicians and keeping them engaged and also rewarding them appropriately. So these are just some of the different areas that we work in as well. And certainly if you'd like to learn more about PDS, same thing. We'd love to hear from you if we can be of help or you think there might be an area that we could help you with your reporting and analytics. Love for you to reach out to us as well. Okay. We hope you found this helpful. And thank you so much for attending this webinar today. Our moderators will stay online and try to answer questions, but if you want to reach out to either Taya or myself, please feel free to use our contact information, reach out. I'm sure to Taya, your website and mine, there's also quite a bit of information and some other things that might be of interest, but always feel free to reach out to us if we can be of assistance.
Yes,
Thank you so much.